Welcome Year 9 and 10 to the second video I'm doing on medieval medicine and health, and this one is going to be focused on the notion of public health. Public health is obviously something that's really important to us at the moment. Obviously I'm talking in March 2020, and in the 21st century the government has a really active role in public health. So what is public health? Well, public health means the general health of the population in a community or in the country at a whole, and what the government or institutions can do to help protect our health. And that's obviously incredibly relevant at the moment because we are currently living under very strict measures in order to prevent the spread of this epidemic. And so public health is really important, and we have our NHS and we have other institutions that are fundamental to trying to keep us really well. And what we're going to think about today is, well, what did people in the Middle Ages think about the idea of public health? Was this something that they would have been aware of the idea of public health or not? So that's what we're going to think about for a few minutes now. So it's probably perhaps easy, or perhaps most people imagine that public health, or that towns, for example, which is what we're going to talk about, were filthy and disgusting, and there wasn't really any idea of public health. But it's not quite that simple. As ever in the Middle Ages, things do improve, and there are some attempts to improve the well-being of the general population of towns. But it is true to say that by modern standards, towns were pretty filthy places where disease was rife. And this was a particular problem because certainly from the late Middle Ages, from the 13th century onwards, towns are growing and becoming more and more important. More and more people are living in towns, so it is something that's significant. And we obviously will need to look specifically at the plague in this period, which is an example of where public health fails. Okay, what do we need to think about? Well, one of the things we need to think about with public health, fundamental things I'd like you to think about, are fresh water. Access to fresh water, absolutely fundamental to good public health, and removal of waste. So it's good water in and bad waste out. That's really important. That's what I'd like us to think about. So in terms of water, what happened in medieval towns? Well, many medieval towns would have been built near rivers because people did need fresh water. If they weren't, there were attempts to try and bring that water in, either through pipes or of course through springs or wells boring down into the ground. As we're going to look at next, we're going to think about the problems of waste removal, and we'll see these ideas of fresh water in and bad waste out. These are very much linked. So what were the problems in terms of waste removal? Well, of course, fundamentally, medieval towns don't have sewers, which is what we're used to having, which are a profoundly important thing for improving our public health. And they also didn't have responsibility for removing rubbish, not just human waste, excrement, etc., but also just the general rubbish. So those two things are lacking. So that's obviously a problem for public health. Right. What systems were there for removing human waste in towns? Well, there were public privies or toilets that people could use, and of course if you were wealthier you might have your own. But obviously without sewers, what happened to that waste? Well, this waste would fall into cesspits, and those cesspits would need to be removed, and these people whose job it was to remove that waste were known as gong farmers. But the problems there were that these cesspits could overflow if they weren't regularly cleaned out, or if there was a heavy rain they could overflow and the waste could flow into the towns. The other problem is that waste could seep into the ground and into the underground water courses, and of course if people are relying on wells, you've got a problem there. And this was a problem that existed for hundreds of years beyond the medieval period, and one of the great things we'll talk about later on is the sewerage system from the 19th century, which begins to solve these dreadful problems. So if those are some of the fundamental problems, another one is the fact that businesses as well as people live in towns, and they would also have to dispose of waste. So as well as so they would possibly or quite possibly use the rivers to dispose of their waste, as would people. So our second problem, we've got privies and how to remove waste, and the second is using the rivers to dispose of waste as well, because waste, of course, can be taken away by rivers. So it's not just people disposing of their waste in rivers, but it's also businesses. Tanners being really, really important and worth investigating why leather production was such a bad polluter, but also people keeping animals in town as well. You've got animal waste and offal, etc., from when the animals are killed, and waste could be disposed of in rivers there. So that's a problem, because of course you've got people drinking or washing in that water as well. So that's another real issue. A third thing, of course, is the thing that we all think about when we think about medieval towns. We think about people throwing rubbish out on the street, and that might maybe not necessarily as common as we might imagine, but it did happen. And again, that was a third problem. So, solutions. Well, yes, there was an attempt by councils to try and address these problems. What kind of solutions did they attempt? Well, they tried to use the laws as they could, and fining people. But remember, it's very, very hard for a medieval council to enforce these laws without a proper police force, which of course they don't have. And you have to catch someone in the act. And that's obviously very difficult. So there was an attempt to try and prevent people from throwing the rubbish on the streets or from throwing rubbish in the water, and there are a number of laws, and if you look at your book on page 17, you can see there are some good examples of laws that councils around the country did try to introduce in the 13th or 14th and 15th centuries. If I just have a little look at one here, Glamorgan Council passes a law in 1330 to stop butchers from throwing the remains of their animals into the high street. In 1371, the London mayors tried to make their city healthier by preventing the bringing in of large animals into the cities, and you can look at some more examples there, and it's always good to have a few of those examples. So there were attempts, but again, very difficult to actually to follow up there. Okay, so public health was taken seriously, but it's not always necessarily, to a degree anyway, but it's not always easy to actually follow those things. Now, the final thing I want to talk about with towns is, well, why? If they were so backward, why were they even bothering? Well, of course, they actually did understand. They made a link between the foul smells and illness. Now, the problem is, what they didn't realise, what they didn't understand, was the notion of germs and germ theory and how germs were linked to illness. So they recognised that where there was rotting food, etc., there could be illness, but they didn't know why. And they thought it was to do with the bad air or miasma, which is something we're going to come back to later on. So there was an attempt to try and remove those things because they knew it caused illness, but they didn't know why. And that's something that, again, we'll come to later on. So, where are there better examples of public health? Well, what we can think about is monasteries. Now, we've already talked about monasteries because we know that monasteries and religious buildings were also acted as hospitals. So in some ways, those hospitals were better for people, where there were infirmaries in those, because there was better public health, if you like, better sanitation within those monasteries. Why? So why were they different? So, important thing, one, they were wealthy. And of course, where there were people were rich as well, they had better sanitation in their houses, and these monasteries and abbeys would have been wealthy. Wealthy why? Well, because they were also businesses, particularly involved in wool production and other businesses, and also because they had rich benefactors who would pass them money. So they had the money to spend to improve sanitation. So that's really important. They were better educated. They were the only people who could read and write, and so they had access to some of the older, the Roman and even Greek learning, where they were making some of those connections between health and sanitation. So that's really really important as well. They were also, in terms of their lifestyles, they led better lifestyles in these monasteries. Order, routine, better diet, they understood these things, or they thought these things were religious obligations, and so those things would have helped them as well. The other really important thing is they're away from big communities. We are currently isolating ourselves because we're trying to keep distance from other people, because we know that that's the way disease spreads. They were distancing themselves from other people, which is why plague affected, in the 14th century, plague affected monasteries less, because they had some distance from other people. So they were often away from other towns, and that would have helped as well. And they would have then also been able to bring water in from fresh supplies away from those towns. So lots of reasons why sanitation was better there. So, what practically happened in these monasteries that were good examples? Well, they would have bathed more often. and it was considered, cleanliness was considered a sign of piety and of religious faith. So most ordinary people would have not bathed at all, or bathed maybe just the bits that you could have seen, whereas monks would sometimes be bathing up to, well, certainly maybe once a month, Benedictine months a couple of times a year, but they would also regularly wash their hands and feet and face as part of their religious rituals as well. So those things would have really helped. If you look at the way that they're built as well, they are much more. The building of these abbeys and monasteries supports better sanitation in terms of bringing fresh water in, and in terms of and how that water is distributed around the building. There's a good map of Fountains Abbey on page 18 of your book. Well worth looking at that, and you can see the examples of how that structure helped better sanitation. So hopefully that's a good little or a reasonable summary of some of those issues about public health that are important in the medieval era. Think about towns, but also think about monasteries. Think about the problems, the fundamental problems, but think about the fact that there were attempts to address some of those problems, even though they didn't fully understand the science behind it. Okay, thank you.